Good day, all. I will be presenting our study entitled Computational Screening of Potential Drug Candidates to Tandem with Remdesivir to Inhibit the Exonuclease Activity of SARS-CoV-2. I am Angela M. Peralta, and my thesis advisor is Professor Harrison Cabrera. COVID-19 is a highly transmissible disease that was first identified as an unknown pneumonia outbreak in Wuhan, China. It is part of the Coronaviridae family and shares significant similarity with SARS-CoV. Common symptoms include cough, fever, and tiredness, and can be further classified from asymptomatic, mild, moderate, severe, to critical based on severity. Based on global statistics, as of September 13, 2023, 771 million individuals have contracted COVID-19 and almost 7 million have died. Transmission can occur through direct or indirect contact. The incubation period has a median between 5 to 6 days, while the reproductive number can increase to 3 due to superspreader events. The mortality rate differs from each region because of factors such as demographics, tested individuals, and their healthcare system. Vulnerable individuals are those of underlying conditions and those who are 60 and above. Non-structural protein 14 is a 60 kilodalton bifunctional enzyme with an N-terminal exonuclease domain implicated in replication fidelity, and the C-terminal N7 methyltransferase domain involved in mRNA capping. The exon proofreading activity is a strategic therapeutic target as it removes mismatched nucleotides. The presence of this activity reduces the effectiveness of RDRP inhibitors such as remdesivir. Remdesivir inhibits viral replication by inhibiting RNA-dependent RNA polymerase. Its mode of action is by transporting a monophosphate nucleoside analog form into the cell. It would be subjected to SIF conversion into an active triphosphate form. This form would then behave as an analog of ATP in which would contend with natural ATP. Nucleotide analogs like remdesivir may have limited efficacy owing to the proofreading activity of the exonuclease domain contained in NSP14. The objectives are as follows. So first, to screen similarly structured compounds using an online-based virtual screening program, filter prospective candidates based on pharmacokinetics analysis, to sort top-scoring compounds based on molecular docking results and analyze protein-ligand interactions, and finally examine drug-drug interactions of the potential candidates with remdesivir. The methodology consists of steps taken to accomplish this study, and this figure summarizes the overall methods. The first step involves an extensive search in numerous articles and literature. It led in acquiring reference compounds that exhibit potential inhibitory effects on SARS-CoV-2 virus. In the Brussels database, a small citation of each reference compound was needed to initiate the similarity search. They were retrieved from DrugBank. Lysica, Screen3D, and Worker were used as search algorithms, and DrugBank was the chosen database to satisfy the condition of only considering FDA-approved drugs. The top 20 similar compounds for each reference drug were chosen based on their similarity scores. The structure of the SARS-CoV-2 exonuclease was taken from the Swiss Model Repository website. The selection process includes Q-mean assessment of each available model. Q-mean scores that are less than equal to -4 were not considered as they are deemed low-quality models. The chosen model possesses a score of 3.15 which fits the selection criteria. The task to seek the grid coordinates was accomplished by utilizing the visualization program PyMol. The active site residues were utilized as reference points in finding the necessary grid coordinates. By entering the center of mass command line, we were able to indicate X, Y, and Z. Pharmacokinetics and toxicological screening were done to obtain vital information in relation to a compound's absorption, distribution, metabolism, excretion, and toxicity. Swiss ADME was used to predict information regarding physiochemical properties, lipophilicity, water solubility, pharmacokinetics, and drug likeness. PKSAM was employed to predict necessary information on concerning toxicity. Both programs required the input of each candidate's mouse notations. The predicted data would then serve as filters in screening viable candidates that express ideal ADMET conditions. Filtered candidates were converted into Mol2 format by using Chimera. The respective mouse notations have been used as an input in building the chemical 3D structure into Mol2 format. The docking process was made possible by utilizing DocThor. Each candidate was docked individually with the exonuclease protein. The corresponding results for each interaction were analyzed. The top 5 scoring candidates were chosen based on their binding affinity values in kilocalorie per mole. For protein ligand interaction analysis, BioVia Discovery Studio aided in molecular docking analysis by visualizing the intermolecular and intramolecular forces present between the protein and each drug candidate. This step would indicate whether the drug candidates were interconnected with the active site residues of the protein or would form adverse bonds instead. All interactions here are color-coded. The last step is to conduct drug-drug interaction of drug candidates with remdesivir. This is in line with the goal to administer a drug compound that would be in tandem with remdesivir, and the combination of both drugs would inhibit RNA polymerase and exonuclease activity of SARS-CoV-2. Medscape, DrugBank, and Hippocrates were used to predict the resulting interactions. So now we move on to the results and discussion. Lipophilicity pertains to the affinity of a molecule in a lipid environment. For that reason, it dictates the capability of a drug to penetrate the lipid bilayer of the cell membrane, as well as its ability to bind to protein molecules. Log p-value is strongly correlated with the compound's lipophilicity. The greater the value, the greater the lipophilicity is. Swiss ADME contains 5 various algorithmic models, with each model having their own criteria and approach. In this study, the consensus, or the average log p-value from all 5 models, was considered. The negative log p-values were not considered as they simply imply a better affinity in a hydrophilic environment, thus an increase in the compound solubility and decreased absorption in the surrounding tissue. Drug molecules exhibiting poor solubility can result in poor or low bioavailability. An ideal drug must attain its intended pharmacological action in systemic circulation at a given concentration and be in the form of an aqueous solution at the location of absorption. A drug must be lipophilic enough to passively diffuse to the lipid membrane and adequately soluble in biological fluids and solvents to form a homogeneous solution. Swiss ADME contains 3 solubility prediction models: ESOL, ALI, and Silicus IT. As to log P was used to predict lipophilicity, log S is utilized to measure solubility. The Swiss ADME database obeys the following rules in terms of categorizing each compound. Since there are 3 models to abide by, a consensus method will be used to indicate the solubility of each compound. If the compound solubility exhibits at least 2 of the same class, then the resultant solubility will be deemed as such. The marked compounds exhibit poor solubility. This study implements toxicological screening by utilizing PKSAM ADMET prediction program. Viable compounds were chosen based on the adverse effects in the predicted tables. The approach in the selection process was that a candidate can only present a maximum of 1 adverse effect. This is done to minimize overall unfavorable effects when one of the drug candidates is taken with remdesivir. Incorporating the gathered data from the ADME analysis to toxicity screening, all in all, there are 19 viable candidates. The Doctor program readily sorts the docking results and presents a top energy pose for each candidate. The top 5 scoring candidates were chosen based on the binding affinity. Binding affinity pertains to the strength of an interaction between a biomolecule and its ligand. The binding affinity is determined by non-covalent interactions. Based on the results, the top 5 scoring compounds are idarubicin, darunavir, digoxin, erubulin, and doxorubicin, while the weakest binding affinity candidate is ivermectin. To analyze and distinguish the top 5 more in detail, they will undergo bond interaction evaluation. Interaction analysis would assist in delving deeper into the intermolecular interactions that both protein and ligand share. Each corresponding interaction is described by color-coded lines as seen in the color guide. The focal point of the analysis is towards the active site residues of the protein. Results suggest that digoxin and erubulin are not viable candidates because of the presence of unfavorable bonds. These bonds would affect a compound's stability. When comparing electrostatic interactions, both idarubicin and doxorubicin have the greatest number of contacts amongst the active site residues, specifically aspartate 90 and glutamate 191, making the 2 compounds more promising candidates in potentially promoting a biological effect on exonuclease. Co-administration of drugs is of great concern, especially when the effects are harmful to one's health. To avoid this, drug-drug interaction analysis needs to be implemented. This study utilizes three various interaction predictors, which are Hippocrates, Medscape, and DrugFact. Darunavir is a strong CYP3A4 inhibitor, and remdesivir is metabolized by the same enzyme. Co-administration will decrease the metabolism of remdesivir, increasing serum concentrations, as well as the risk of severity and adverse effects. For digoxin, substrates of the PGP transporter may result in the increased serum concentration of narrow therapeutic index P glycoprotein substrates due to the competition for PGP transporters since both drugs are PGP substrates. For doxorubicin, remdesivir is a CYP3A4 enzyme inhibitor, and the affected drug is metabolized by the same enzyme. Co-administration will decrease the metabolism of doxorubicin, increasing the serum concentration and therapeutic effect. Drugs with narrow therapeutic index must be maintained within a specific concentration range in order to be safe and efficacious. Based on all the gathered data, it was then concluded that the most feasible drug is indarubicin. It possesses the lowest binding affinity score, and interaction analysis showed that it shares significant electrostatic interactions with certain active site residues. It also exhibited no undesirable interaction from drug-drug interaction prediction when co-administered with remdesivir. Furthermore, the outcome from pharmacokinetics and toxicity screening revealed that it presents ideal ADMET properties and with minimal probable adverse effects. The findings of the study will be one of the first steps in drug discovery and development of potential drug candidates that would inhibit SARS-CoV-2 exonuclease. Thank you for listening. Once again, I'm Angela M. Peralta, and good day.